Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
Welcome to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. I'm Steven Newmark, Chief Policy Officer at the Global Healthy Living Foundation. Our goal is to help you understand what's happening in the healthcare world to help you make informed decisions to live your best life. This fall's vaccine season is shaping up to be one of the most confusing we've seen in years. The FDA, medical societies, states, and the Federal Advisory Committee on Immunizations, known as ACIP, are not all on the same page. In fact, ACIP is meeting this week, September 18th and 19th, to discuss key vaccines for both children and adults, including COVID-19, hepatitis B, MMR, and RSV. Their recommendations are highly influential, often determining which vaccines insurers cover and pharmacies distribute. Add to that the recent firing of CDC Director Susan Menarez and the turmoil around vaccine policymaking generally under Health Secretary RFK Jr., and it's no wonder patients are asking, who is eligible for vaccines? Will insurance cover it? And what should I do for myself and my family? Today, we'll try to clear the fog and give you some straightforward answers. So let's start with eligibility. The FDA has limited its COVID-19 vaccine approval this fall to adults 65 and older and adults 16 to 64 with at least one high-risk condition. That's a major change. In the past, the vaccine was authorized for everyone over the age of 6 months. Meanwhile, medical societies are not waiting for the FDA or ACIP. The American Academy of Pediatrics is saying that to vaccinate all kids under 2, high-risk children, and even children outside those groups if parents want additional protection for their kids. The American College of OBGYNs recommends the vaccine for pregnant people at any point during pregnancy or while breastfeeding. And the Infectious Disease Society of America blasted the FDA's move, saying narrowing the eligibility, quote, ignores science and puts millions at risk. So, depending on whether you look at the FDA label or medical society guidance, you might get a very different answer to the question, am I eligible? So, an important question baked into the FDA's determination is, what counts as high risk? High risk is not defined by the FDA, but the Centers for Disease Control, CDC, has guidance, and it covers a wide swath of the population. People with diabetes, cancer, obesity, disabilities, pregnancy, certain mental health conditions, and of course, folks who are immunocompromised. Most pharmacies around the country are going to rely on what is known as self-attestation. That means you essentially self-attest, check a box that you confirm you have one of these conditions. However, it is possible that some pharmacies in some states may require an actual prescription from a doctor. It's unlikely that insurance companies will require proof if you self-attest, however, though it is possible. Insurance and off-label questions. Here's where things get even trickier. If you fall outside of the FDA label, but your doctor recommends vaccination, say for a healthy child, a 6-year-old child, that would be considered an off-label prescription. Prescribing off-label is common in medicine, but there are challenges. Most pharmacists can't give off-label vaccines. Physicians can, but many hesitate without clear coverage rules. Insurance may or may not pay for off-label vaccines. If insurance won't cover it, families may need to pay out of pocket for the COVID-19 vaccine. Timing and safety. When should you get the vaccine? You can technically get the vaccine now, though it has been taking some time for some pharmacies to completely stock up. If you've had a COVID infection recently, you should probably wait until about 6 months before your next shot. The formula has been updated to better match the currently circulating variants. And let's be clear, the science hasn't changed. The vaccine remains safe and effective. What has changed is the policy-making environment. So, some practical advice. What should you do now? Well, if you're 65 or older, if you're in a high-risk group, which includes anyone who is immunocompromised, you should plan to get the vaccine this fall. Parents should talk to their pediatricians directly about whether they're following the American Academy of Pediatrics recommendations or other guidelines. Pregnant individuals should talk with their OBGYN as well, and everyone should check with your insurance company to see who will be covered. As for me, I'm going to rely on the guidance of professional medical societies and my personal physicians. These are groups that I recommend. They ground their recommendations in evidence and patient outcomes. I also surely trust the doctors that I see. So, this year's fall vaccine rollout highlights how much confusion patients face when politics and science collide. My advice, lean on your trusted providers, know your options, and remember that vaccines remain one of the best tools we have to prevent serious illness. As always, you can find more resources and patient-focused health policy updates at GHLF.org. Thanks for listening to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. If you found this episode helpful, please leave us a rating or review and share it with someone who cares about healthcare policy. And be sure to follow us wherever you get your podcasts. You can find all of GHLF's podcasts at ghlf.org/listen. I'm Steven Newmark. We'll see you next time.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.